Well, they say you can't judge a book by its cover, but that doesn't seem to stop us. We humans are a judgmental breed, whether we like to admit it or not. And that applies to people, not just book covers. You've heard this before. The first impression lasts the longest. And it's true, too. Studies from Princeton University indicate people make their first impression just fractions of a second after seeing someone's face for the very first time. Trustworthiness, likability, attraction. We can judge all of these things in less than 1 second. So that's why today we have a special guest on with us. Trust us, here's a guy who can turn your frown upside down. Dr. Vartan Martirosyan, a renowned facial plastic surgeon from the West Palm Beach area, Jupiter, Florida. Doctor, thanks for joining us today.
Thank you very much, Mark. It's a pleasure to be with you on the show.
And you as well. Now, I have to ask, the holidays are coming up soon. Suppose there's this married couple. The husband is maybe thinking about buying plastic surgery for his wife, but he's not really sure how that conversation will go over. How would you recommend he bring that up? Of course, I'm asking for a friend.
Well, so we have to be really careful when we have a couple thinking about a plastic surgery and we have a husband, for example, recommending plastic surgery for a wife. I just wanted to say this in the beginning. We always have to make sure that it is the person who is receiving the surgery that is absolutely convinced that they need it, okay? And we have to make sure they have realistic expectations. So that is one thing that we take the time to listen in our office here in Jupiter, Florida, and to make sure that the expectations of the patient are realistic and that the desire to have plastic surgery is actually their own desire. That is of paramount importance.
I understand. Now, I also understand that you've done a lot of work on cosmetic surgeries all over the world. It's not what people think oftentimes. For instance, you did some work for several victims, I understand, after the Boston Marathon bombing. Tell me, how much did that mean to you as a doctor to be able to help a patient recover after such a troublesome time like that?
It meant a lot. It meant a lot. And actually, that was one of the moments where I realized that my future lies within facial plastic surgery. Taking care of the victims of the marathon bombing was absolutely important for my professional decision and very determining. In particular, I took care of a patient that had a problem with movement of their face after the explosion. One of the shrapnels had transected facial nerve, and so I had to go to the operating room. The first time I had to do it just to restore the integrity of his ear that was also lacerated. However, the second time I had to reconnect the terminations of the facial nerve to give him movement of the forehead. And the particular moment is that he woke up from the anesthesia from the first procedure, and then we discovered that he had an additional injury. So we had to get him ready, explain everything, perform all the appropriate diagnostic tests, and get him back to the operating room because we had a short window of time to have the best result.
And that's quite a fascinating gift that you can really give to someone. I mean, sadly, there are several people in Boston that still bear those injuries outwardly, and for a few people that you were able to help there, they're able to heal and have that closure. But that's not your only connection to Boston, I understand. For our viewers, Dr. Martirosyan studied abroad before doing advanced research at MIT and Boston University. Doctor, do you still keep in touch with people in Boston? Do you have any patients there? Do you have any connection with people in Boston still?
Oh, absolutely, absolutely. I am in close touch with all my colleagues and some of my mentors at Boston University. We meet at meetings. I was recently there, and we even went trick-or-treating with a good friend of mine. It's a deep relationship. It's a deep connection. That's where I did spend my first years in the United States before coming to the Sunshine State.
Let me ask you a question about the surgeon business in general. I've always been curious. What's the recovery period like for the average patient who would go through one of these procedures?
Well, of course it depends on the type of procedure, but what we pride ourselves at the Plastic Surgery Center for Excellence here in Jupiter is that we perform minimally invasive approaches for the usual procedures, such as we specialized in a minimally invasive facelift and neck lift with minimal incisions and without the need to intubate the patient during the procedure. So we do everything under twilight sleep. The type of anesthesia we use, yeah?
Recovery, how are they staying in a facility for some time?
Most of our patients recover in outpatient setting. Some of them can choose to go to the so-called mid-level facilities, but most of them really go home with a caregiver, and they have a predictable and short downtime after the procedure. The techniques of anesthesia we use limit the pain after the procedure, which is also very important, and the dressings are kept for 18 to 24 hours only.
Okay. Well, I mean, you mentioned this a minute ago, but of course there's several different options, everything from lip lifts to eyelids or a J lift. How much do operations like this normally cost?
So for J lift, which in reality is a minimally invasive facelift and neck lift, the cost is around $6,000 to $7,000. A lip lift could be just under $2,000. In particular, the lip lift is a very nice, I can even say a lunchtime procedure, which is performed in our office within 30 to 45 minutes. It's a nice rejuvenation option for the upper lip, which with time, unfortunately with time, what happens, the upper lip gets longer and it covers the upper teeth. What we do with the lip lift is actually we contrast the effect of time. In this way, we give a natural appearance to a fuller lip and very youthful looking smile.
Now, do you find that most patients will pay for plastic surgery out of pocket, or in some instances would insurance kick in and cover the cost?
Most of it is paid out of pocket with the so-called disposable income. Some self-insurers, some self-insuring companies with the insurance agency would cover plastic surgery. However, the most of them are cash payers or self-payers.
Now, that might answer this next question as well, but would this be something similar to, like, let's say, a regular specialist where patients have to go through a referral from their primary care physician, or how would someone hear about a person like yourself?
Well, believe it or not, the most powerful source for referral is word of mouth, and that is the one that most of our patients choose. The other type of referral is, for example, a patient who had a procedure several years ago is interested in another procedure, and that's another possibility. A lot of times the patients want to know about your background, want to know about your training, they want to know about your expertise and the number of cases that you have done, what your experience is, and we're definitely ready and more than happy to give them this information.
Now, even in a day and age when disposable income is not something everyone has waiting around, cosmetic surgery is still taking off in popularity over the last 10 years. It's happening in men and women when you look at the numbers. Do you think celebrities have played a role in shedding light on the industry, or would you say it's growing more organically, like, word of mouth, as you mentioned?
I think it's both ways. That's, of course, the easy answer.
Of course.
I think what's happened with the years is a lot of the procedures have become, of course, more affordable. The other thing is, and that is very much reflected in our practice, a lot of the techniques have become minimally invasive. In other words, we can use minimal incisions and minimal downtime and also reduce the time of procedures to achieve the same or even better effects compared to the ones that were achieved in the past. So in other words, cosmetic surgery has gotten closer to the patients and to the potential patients than it was before.
Now, because insurance isn't really a part of the equation, and I want to throw this question at you, I apologize if it's kind of out of the blue here, but I'd like to get your opinion on this. As someone who's worked in the industry there, you said that prices are going lower, and a lot of that might be because people are paying out of pocket, and there's kind of a competition, I would think, between trying to attract business from one place to the other. Is there any part of that dynamic that the major medical industry in this country can adapt and use to try to lower the cost of healthcare?
Well, free competition will definitely help with, I think, with healthcare, and there are definitely models where there are facilities like surgical suites or surgical centers in the country that actually enter in direct agreement with the employers, where, if you want, this is a model of insurance without the insurance agency. And this is how, for example, companies like Kaiser started in the beginning. So say that a surgical center agrees with an employer to take care of their patients without intermediaries, okay? So if the employee of this company or employer needs a procedure, they go directly to that surgery center and they get charged with a more reasonable price. Let's put it this way. And this, I think, in my opinion, is a very successful model, okay? And that's a model that you can also claim has been borrowed from cosmetic surgery, because more or less the relationships that we have from that standpoint are similar.
That's an interesting point, really. But also, in your line of work, I mean, self-esteem, let's say, it's really a major psychological component. How would you describe the long-term effects of an external operation and the way it impacts the way someone feels on the inside?
Oh, it's huge. It's huge. But again, that goes back to the first question you asked me. What happens if somebody, a family member, recommends a plastic surgery procedure to another family member? This is the very reason why we like the patients, actually we love the patients to take decisions for themselves and to have realistic expectations. Because once those expectations have been fulfilled, and again, in my practice here in Jupiter, Florida, we take the time to listen to the patient to make sure that their expectations can be fulfilled. Now, when these are fulfilled, then the patient definitely builds more self-confidence and can even use this as an investment for a future career or even a future relationship. The important thing is, though, that in the moment when you sit with a patient and discuss the procedure, what the downtime would be and what the results would be, then you have to be maximally clear, tell them what the perks, what the pros and cons are. And that's when, if you have performed this correctly, then you can benefit from a, psychologically fulfilled and confident patient with the results of the surgery.
That's fascinating. One last question before we let you go. Would you say there's perhaps an unfair stigma attached to people who might seek out plastic surgery?
Well, it's our tendency is always, there is a human tendency to judge the others, but I don't think in this day of age we are supposed to do that. There probably is some stigma in some environments, but I think the most important thing is for the person that receives surgery to feel self-confident after this. This is the most important thing, and this is what everything turns around. I know there was, recent buzz about celebrities, having changed their appearance, and so on and so forth, and how they didn't look exactly like they looked before. But let's look in the person and their comfort and their psychological peace. If this type of procedure contributed to their psychological comfort, then that's it. That's the answer. So I frankly don't see any point in judging people and having stigma of this kind.
I think it's a point well spoken. Doctor, thanks for joining us today and helping us to shed some light on this topic.
Thank you very much, Mark.
All right, that was Dr. Vartan Martirosyan from Palm Beach Plastic Surgery. You can find out more about him at palmbeachplastics.com. Up next, we have today's special reports. Keep it here at WHDT World News. We'll be right back.